San Diego 6 News in the morning. Your station for balanced news.
All right, well, if you're one of millions of Americans who suffer from back pain, you're going to want to stick around for this. Up next, our guests will have some advice for patients.
Well, it's estimated 90% of us will suffer at least one bout of debilitating back pain in our lives, and you can add me to that list. We often wonder, how can we get some relief from our nagging backs? Luckily, Dr. John Finkenberg, an orthopedic surgeon from Alvarado Hospital, joins us with some answers. Now, for some people, they may have a bout of bad back pain for a month or two, and then the symptoms disappear. But when do you know that you should see a doctor? When do you need to see help?
I always tell patients, if your pain lasts more than 3 days and is in the level of 7 out of 10 in severity, 10 being the worst, then you really ought to see a physician and find out why it's not improving.
Let's talk about what causes bad back pain and how you can prevent it. I know posture, as I straighten up here on the seat, that's a good thing. Also, you know, incorrect lifting. But what causes bad backs? It probably varies for people, but...
It definitely varies, Eric. The causes really have not changed over the years. What's different is our ability to pinpoint what the pain generator is. And various tests such as injection treatments, very advanced MRIs and CT scans can show you exactly where that pain is coming from. And once you find that area of pain, if you can match the symptoms with the physical exam and the x-rays, then your chances of getting a good result with any treatment are going to be better.
How can you prevent back pain? I know that I have a problem with degenerative disc disease, and if I do core exercises on the ball at the gym, that helps me, but everyone's a little bit different.
Yeah, I think it's very difficult to prevent it. 80% of adults will get some type of back pain that lasts more than 3 days. And I always tell people that if you do your stretching exercises, try to keep a fitness program going, modify the activities that seem to cause the pain, and then prepare for things that you don't normally do, then you'll be in good shape.
And let's talk about some treatments, new treatments to prevent back pain.
Well, what we're doing at the Advanced Spine Institute now at Alvarado in San Diego is we're trying desperately to find out different ways of determining where the pain is located. Once we go to the painstaking efforts of doing that, there are procedures these days that are called minimally invasive. And the goal as a surgeon actually is to find that pain and do something in a least invasive method to try to resolve that discomfort. And if you can do that, people seem to do better. They get back to work faster, less hospitalization, and obviously less costs.
Now, I know you have a back attack seminar coming up. Lots of tips so people can avoid this program. Tell us a little bit about that and when it is.
The lecture is going to be on Wednesday, this coming Wednesday at 6 o'clock at the hospital in the evening. And basically it will go on for an hour. I'm going to try to not talk the whole time so I can do a lot of question and answers at the end. But the key for that is for people to realize what's available to them now and ways of preventing back pain in the future.
And last question I have for you. People that have bad backs, a lot of times you just want to lay down and you think that's going to relieve the pain. Probably not a good thing to do?
Interestingly, years ago we used to put everybody in the hospital for a week and tell them not to move and put them in traction and that type of thing. These days we're actually telling them to try to get up and move around. If you walk on level ground and do gentle stretching maneuvers, you're not going to have a problem. So it's better to get up and keep moving.
All right, some great advice. I will take it to heart. I know our viewers will. Appreciate you being with us on this Sunday morning. Thanks for joining us.
Thank you, Eric.
Well, for more information on doctors, the orthopedic doctor here, just go to san diego6.com.